Are you about to have bariatric surgery? You want to know where the scars may be, how many there will be, and what are they being used for? And honestly, those are very common and reasonable questions. Hi, I'm Grace, and I'm a physician assistant with 20 years of experience working with bariatric patients. So today, let's walk through a typical laparoscopic bariatric surgery incision placement pattern and why your own incision placement may be a little different. First, a quick disclaimer. Today's video is medical information only. It is not personalized medical advice, and you should always follow your bariatric surgery team's recommendations. Your incision placement will depend on your surgeon, your anatomy, your procedure, and what happens during surgery. So if incision location or scarring is a concern for you, be sure to discuss this with your bariatric surgeon before surgery. For many laparoscopic bariatric procedures, patients usually have about 5 to 6 small incisions. On a typical incision diagram, you may see one higher incision near the upper abdomen. That upper incision is often used for what's called a liver retractor. The liver sits right on top of the stomach during surgery, so the surgeon needs the liver gently lifted away while he performs your procedure. Then you may see 2 small incisions on one side of the abdomen. Those are used by the primary surgeon to place instruments and do the main work of the operation. On the other side, there may be 1 or 2 incisions that are used by the first assist. The first assist helps with exposure, retraction, camera or instrument movement, and other parts of the operation depending on the surgeon's technique. And then there is usually one slightly larger incision. For sleeve gastrectomy, that larger incision is commonly where the removed portion of the stomach comes out. In a sleeve, about 70 to 80% of the stomach is removed, so that piece has to come out through one of the incision sites. That's why that one incision may be a little longer than the others. Most of the laparoscopic incisions should be around 1/2 inch. The one larger incision is usually about 1 inch long. Again, these are general estimates, not guarantees. Now, sometimes patients ask, why did I get more incisions than someone else? That does not necessarily mean something went wrong during your surgery. There are many reasons a surgeon may need an extra incision. Sometimes the first assist just needs another port. Sometimes the patient's anatomy requires better angles that cannot be achieved with the incisions that have already been made. The liver may be larger or harder to retract. Sometimes there's scar tissue inside the abdomen from prior surgery, infection, or if the operation is technically more difficult than expected. But the key point is, incision placement is not about making the nicest looking pattern. It is about doing the safest operation. How are incisions usually closed? After surgery, many bariatric incisions are closed underneath the skin using dissolvable sutures. Then the skin is usually covered with a sterile skin glue. The glue acts like a protective covering while the incision begins to heal. And this glue usually flakes off on its own, similar to a scab, within about 2 weeks after surgery. So don't pick at it and don't scrub it off. And please don't put random creams, lotions, or even band-aids on these areas unless instructed to do so by your bariatric team. If scarring or incision placement is something you're worried about, be sure to discuss this with your bariatric surgeon prior to your surgery date. You can ask, how many incisions do you usually make? Where do you usually place the incisions? Which incision is used to remove the stomach? Do you ever hide the larger incision near or inside the belly button? When would you need to add another incision? How do you close the incision? What wound changes or symptoms should make me call the office? These are all reasonable questions. You are not being difficult. You are just trying to prepare yourself. Most incisions heal without any problems, but you should know what to watch for. So when in doubt, call your bariatric team. So the bottom line is this. Most bariatric surgery patients will have about 5 to 6 small incisions, and each incision has a job, but your exact incision pattern may vary, and that's okay. The safest operation means a lot more than a perfect scar pattern. If you like this content, or you're trying to figure out what life after bariatric surgery is actually like, subscribe, because that's exactly what we discuss on this channel. I release 3 videos a week that help you think through and understand all the options in the professional weight loss world. Thanks for watching, and I'll see you in the next video.